I think with no further ado, we better get on with it. Thank you, Brendan, very much for that, those introductory remarks. So today what I'd like to do is to talk to you about the relationship between social entrepreneurship and global mental health a little bit, how I got started in this particular field. And I'd like, of course, to introduce you to BasicNeeds. That would be an obvious thing to do. But perhaps more in particular, I want to focus on the model for mental health and development, which I suspect will go to the core of your own interests in the talk today and will probably spend most time on. I'm proud of the impact that we achieve globally, and I'd like to just share that with you in terms of data that we've produced, and then share with you also a little bit of the way forward. And then after that, let's have a conversation, let's have some questions, whatever suits you and whatever time allows, or is allowed by the organizers. So moving on then, I just wanted to put a very simple point to you really, which is what does an entrepreneur, what does a social entrepreneur do? And in my case, I was in about 1999, 2000, around there, I was indeed the chief exec of that organization you mentioned, the International Development Group, and was looking, the one started by Schumacher, and was looking at a number of country programs, was visiting country programs. And I had become increasingly interested in mental health and mental illness. And I asked the simple question, why do so many mentally ill people seem to be sitting in the street, particularly those that I now understand had psychosis or schizophrenia, or whatever they may have been. And why are they sitting there, and why is no one interested in them? And so that was a question I began to ask when I was in my former job, so I sort of moonlighted in a way. And I was eventually ending up sitting next to people who were seriously ill and asking them a question: what are you doing here? Where did you come from? And what do you think will happen to you tonight? And so by using that framework of questions, very simple questions, I began to understand that people had really very serious problems. They were facing very serious problems, and they were also highly stigmatized, highly repudiated, even by the passers-by that were passing me and them by as I was talking to them. Hey, what do you want to talk to him for? He's crazy. Don't you get it? And so there was a lot of that kind of implication going on right there. These were in a couple of countries in Africa. So I said, but he's doing me no harm. I felt argumentative, and which is something that's not usually in me. And so I said, he's doing me no harm. And they said, but he will do. And so there was this kind of sense in which people carried their own destiny inside them, but not in a good way. It was like we expected them to be violent, in quotation marks. And so all of these things then led me to ask those basic questions. And an entrepreneur, basically, when they see a problem of this type, they don't think, oh my God, this is a disaster. They think, how can I solve that problem? And so, and of course it takes, does it not? It takes a certain streak of stupidity, I would argue, certainly my wife would, to think that you could solve a problem even in a small way of this type. And yet at the end of the day, as we begin to unravel this issue, we begin to see that, as the old phrase is, it's not rocket science. Indeed, a lot of it, as I now feel, is community development, as distinct from anything else. So one of the hypotheses that I'd like to put to you is that a lot of this work can be carried out, can indeed be task shifted through the context of community development. It's not a panacea, and it does not replace good psychological and psychiatric treatment, but it certainly adds greatly to it. And I think that's probably one of the kind of fundamental theses that I wanted to share with you. So the solution then started to, in social entrepreneurship, I don't think there's a eureka moment, or at least there isn't for me. So it wasn't as if I knew the answer in a kind of pompous sense, but I knew that I wanted to work on the problem. That's really what I knew. And so, still moonlighting, I started to look at ways in which I could find myself more adjacent to and working with people with mental health problems. And until finally, that moment that many social entrepreneurs talk about, which is essentially that of serendipity or some such, a knock on the door, and a guy comes in and says, "Do you have another organization in you?" Pointing, I thought, rather rudely at me. And he said, "You know, you started 8, as it was at that time, and isn't there a 9th inside you, like there should have been?" And I said, "Well, funnily enough, it's funny you should ask, but I've been thinking for the last couple of years about people with mental illness, and I really would like to start an organization in that field. What do you think?" The gentleman in question had mental health difficulties himself. And I have come across many people who have facilitated the way for me, especially financially, from people who themselves have close experience of one particular mental disorder or another, or their families have. And so it's interesting that although people are sometimes shy to talk about this subject in their own familial context, they do actually make the experience work at some level. And so in this particular case, he made the experience work for me. And a little bit later on, we started out with this mission and vision, as you can see on the screen there, with an organization fully intact, with £1 million in the bank, ready to roll. And that was due to him, not due to me. He was the person who was able to go in front of me, and he was able to find the money and to bring it together and to give us the working capital that we needed. And those kinds of blessings have been in this organization from that early stage, 99, 2000. It's not that we are now so rich anymore, but it is the case that we were given a great start, and that was important. So we started with this development pantheon in the back of our minds, this idea that perhaps, well, I'll put it in a slightly different way. Is it not the case, we said to each other, those of us who are working on this quite a lot by this time, is it not the case that mentally ill persons, for example, those very mentally ill people that I talked about earlier, is it not the case that they are also citizens of their own country, that they have citizens' rights? Aren't they just as qualified to be a citizen, to be a contributor to the economic and social development of their own countries? Why not? That was the naive or faux naive question that we asked of ourselves and of others. And so that's how the journey began, really, more than anything else. And it wasn't until I jumped into an old Ambassador motor car in India in 2001 it was. And Naidu jumped in as well, my friend who had helped me to work through and to get it started. And a gentleman called Sonny George, who was writing everything down. He was kind of writing the early history of these thoughts. And we bumped off along the pathway to our first meeting, because what do development workers do? They listen to the client group that they presume to want to support or to help. So Naidu turned to me and said, "Right," he said, "so what's the program? What's the agenda?" And I looked, my tummy sort of dropped, you know. I said, "Oh, I thought you knew that." And so we constructed, not in the privacy of a laboratory or, you know, the hallowed portals of a major university, but we constructed in the back of an old motor car the basics that I'm going to share with you today. Yes, they have become more refined, and yes, we have backed them with important contributions from statistical science evidence. But nevertheless, it's interesting to note that in the spirit of entrepreneurship, neither of us knew what we were doing, but we both knew that we had to do something about this particular problem. So here is this model that we conjured so quickly in the back of the car. The capacity building piece for us meant let's listen. So I'm going to give you a bit more detail in a minute. I'll just whiz you around and then I'll come back to a few more slides, a bit more detail. So it was about the let's listen piece. The community mental health piece was the way in which we could best and optimally access the treatment potential in that particular country. So don't forget, these are all developing countries, low and middle income countries. For us, one of the great pieces of the model that we really placed hope on in those early days was livelihoods. And because we argued, isn't it the case, and Brendan echoed that in his introduction, isn't it the case that poverty is just making this a whole lot worse for people? And we're not talking about $1 a day poverty, but we're talking about poverty which is grinding, insistent, and never ending. And so if you have a depression, if you have a mental illness, if you have a mental disorder of some kind which you are living with, trying to live with, and perhaps being stigmatized about, and you also have the worry of your family's poverty and their dependence on you maybe as a wage earner or as a worker, doesn't that make it a whole lot worse? I had run a number of organizations, and I was ashamed to say that in some of them I had been cavalier with the evidence. Now, that doesn't mean to say that I lied, but it does mean to say that I didn't understand the full importance of it. And so when I was given the opportunity to start a new organization, and certainly in those days, one where the data, particularly operational data, was so scarce, I felt it was really important to wake up, I'm talking about myself here, to wake up, get real, and put some of that hard-earned investment into making sure that there was a data collection service running alongside the rest of the operation. And so that's what we did. And I've never regretted it. And in many ways, it's what makes it easier for me to come to you today and to talk with a certain confidence about what we're doing, because the evidence adduces it and has been tested by third parties and so on and so forth. Collaboration, which is the final piece there, is really what makes the rest of it tick, as you'll see in a second. It's really where we bring organizations together, empower them, and teach them how to run this particular model. And actually what's interesting is that in a way, we don't deliver any service at all at the end of the day. We deliver the ability of others to deliver the service. And so our role as a catalyst or as a facilitator is, I think, important, and has certainly meant that we've been able to reach out to a large number of people, because we're not operationally invested in any one particular program. So here's the capacity building taking place in Africa. The first thing I'm always reminded of in this particular slide is that we are completely entrenched in culture. We employ local people, we involve local people. All the partners that are working with us are local organizations. So it's natural that when a group of people are called together to talk about a subject which is in itself taboo, it's natural they will configure themselves in a traditional way. It's the way in which hundreds of meetings take place. So you have a person who is facilitating, you have the women on one side, you have the men on the other, and there'll be ranking within that simple description, so that you've got older and more senior women in particular places in that grouping, and so it goes on. And so the facilitator has to be completely understanding of that. One step wrong at this stage, one step wrong at this early stage, when we have said, please bring anybody who you think is mentally ill, and please come if you think you are mentally ill. Please come to this meeting and we'll have a discussion about all of this subject. So 1 foot wrong at that point, and you're well set back, and you've got to make another start. How do we get people there in the first place? Well, one of my most favorite ways is in Africa, at least, sub-Saharan Africa, is through FM radio. So radio stations, disc jockeys, guys pumping out the music, adverts, so that it's the real stuff of life. It's like right there in your face. It's happening, it's music, it's what people like to listen to. They're working, they're tapping their foot to the music, they're getting on with their lives. And through that, then suddenly comes a public service message, which there are many such messages going along all the time in FM radio. And so I went to, in Tamale in northern Ghana, I went to see the disc jockey. They said, you might want to do a bit of an interview at the same time. I said, fine, And he said, hey, white man, why do you want to meet crazy people? It's like everything gets just cut back. It's just like you're back, you're right there. It's like raw. And so I said, in my sort of less queen voice, but nevertheless, sort of still obviously very much an Englishman. I said, well, we want to meet people with mental health problems. Yeah, I know all that stuff. Why do you want to meet crazy people, he said. And then we whacked on another record, and off we went, and another more music, and then he was chatting. He was trying to work out himself with me why I wanted to meet these people. In the end, he said, I don't know why he wants to meet me. But all I know is that if you go to the schoolhouse on this day and then, you'll meet him and his friends, in that case it was a women's organization, who were leading in the empowerment process. It was great fun. And as a result of that, tons of people turned up, which was exactly what we wanted. And everybody wants to be a part of it. So instead of it being kind of embarrassing and a bit horrible, and sort of like, we don't want to talk about this subject, it was like people arrive and it makes it a bit more kind of upbeat. If you get to be on the radio, it's sort of more fun. Obviously, there are other ways of calling people together through you would be pretty silly, wouldn't you, if you were working in an African context and you were not, by the way, consulting with traditional headship. And if you were not going to local government headship and saying, look, this is who we are, can we work with you? Can we be here? Is it okay to do what we now want to do, and then describe it? And so, obviously, by the time you actually hold the first meeting, as we see in the photograph, a great deal of preparation has taken place. Perhaps in some cases up to 6 months worth of preparation. The big investment in a program like this is everything that happens before any kind of mentally ill people become involved on a daily basis with the program. So the big moment arrives, and then people begin to get together. One of the outputs of a community, of a capacity building series of meetings, because it's not one obviously, is that people start to want to meet again. So they say, we'd like to meet, and then we through our partnerships would be saying, so how do you want to meet, and what is it you want to meet about? And sooner or later, people say, what we want to meet about is work. We need to work. We need to make money. And we also want to know why we are being stigmatized. Now, they don't use that phrase. They say things like why people throw stones at us, or why people don't invite us to their parties, or why, they use fresh, raw evidence of their stigmatization. And so those are usually top of the agenda. That's why people think that they should come back for a second meeting in the capacity building series, or a third meeting. And after a while, what becomes evident is that they're coming together and organizing themselves. more than we are organizing them. And so, in a sense, what then happens is that they then say, well, why don't we have a chairperson who then starts to lead the session a little bit from there. And then somebody says, well, we could do some savings here. Because this is all tradition. This is all tradition. This is what people do when they meet. When women meet in many of these countries, they start to decide to come back together again. They appoint a person to lead the organization. It becomes an organization. So self-help groups are an important feature of the program. And we now have over 500 self-help groups across the countries that Brendan mentioned, with over 20,000 mentally ill people in those groups. And most of them are self-managing. So when we get to the question of sustainability, one of the features of sustainability in this program is that it has this large underlying substrate of self-managed community-based organizations. But in answer to the question, why are we being stigmatized, the basic question about the mental health issue, we, of course, also have to work with another partner. And this partner, of course, is the Ministry of Health. Now, in a subject where, to be honest, you could work almost in any low or middle income country and find a situation where you could, as it were, be made welcome to some extent by the community that I'm referring to. Nevertheless, at the end of the day, it seems to me that it's really important to be made welcome by the government, because this is a chronic illness. It's a chronic condition. No non-governmental organization, no matter how competent its ability to be able to attract funds for the programming and so on and so forth it may have, no NGO is going to be able to be a substitute for the long-term commitment of a reasonably well-informed government. And so therefore, it's extremely important to start the process right from day one of negotiating with government. And so in the end, although it wasn't always as simple as that for us, but in the end, we probably won't work in a country unless we feel that the government is going to really make us feel welcome, which means signing an MOU, which means a relationship. I'm really pleased to say that now, in most of the photographs that we'll see today, whenever you see anyone who looks vaguely like a nurse, or a nursing auxiliary, or of course a doctor, or of course a building, or a vehicle, all of these are provided by government, the government where we work in that particular country. And that's very important. And to achieve that leverage is quite significant, actually. What we haven't done, and it's a great project for the right student, what we haven't done is we haven't monetarized that in-kind leverage, and it would be a very important thing for us to be able to do in due course. It's probably even the subject of a PhD, I don't know. But the point really is that it's an important feature of the relationship with government, and we find that very valuable. If you talk to particular doctors, particular psychiatrists, psychologists, and so on, Laos, for example, they say one of the things that is really significant for us is that if we become part of this program, meaning if we are able to play a part in the overall program structure, a lot of the administration falls away. So a lot of the kind of how do I get myself as a practitioner in front of people in the community, all of that issue falls away because it's all in hand. It's not in hand because BasicNeeds put it there. It's in hand because the self-help groups are there. It's in hand because community health workers are working as part of the partnerships that we are creating. And so what's possible is for the handful of senior psychologists or psychiatrists, they are able to provide a steadier, more consistent flow of diagnosis and of supervision, which of course is what they seek. It's also possible for nurses, fully trained nurses, to be able to do the same at their own level, and so it goes on. And so whilst in the end, the provision of these services, the medical services, in the full sense of both psychological and psychiatry, whilst they are still rough and ready, to be blunt, because of the paucity of the number of people involved, nevertheless, to be able to optimize the ability of the professional to be able to seek and see more people, and also to seek and see them in their homes quite often, is of course very important. Most of the countries we're talking about have one mental hospital in the old style. One, if it's a British colony, ex-colony, then it would be known as such and such an asylum, such and such a mental hospital. And in most of the countries that we're talking about, mothers will tell their children, if you're not good, I'll send you, to Bedlam. I'll send you to, And so to be able to start the first small footsteps, to assist people to not have to go to, in quotation, Bedlam, and to be able to live at home, which is my goal as the founder of the organization, and to be able to be treated, if not at home, then at least near their home, in a local clinic and so on, is of course an enormously important step in not only the way in which we would think about mental illness in that particular country, but also of course in the professionalization of the hospital itself. Because if the hospital doesn't have to see itself as a bin, as a loony bin, if it doesn't have to see itself like that, but if it can see itself as becoming the tertiary provider of complex diagnostic services for short periods of time, so as to be able to route people back home again, that's a very different, a completely different subject to the way in which the hospital was then originally conceived of, at least in the recent history. Livelihoods, you remember I said that in the context of livelihoods that we had built some hope around that in our hypothesis in thinking through this particular program. And it's turned out to be the case, in fact, that most people, when they come into these capacity building meetings and they get consulted, most people say, what we really want and need is a job. So how do people get to be so poor? Now, of course, quite a lot of people are poor anyway. But if you have a mental health problem, it is quite possible that you have spent quite a lot of money or resources. You've spent money either traveling to try and seek treatment. If you go on many of the buses in many of the countries that I've been talking about, the people in the bus won't let you get on the bus. They say, no, you're crazy, you can't come on this bus. Unless you have someone who will go with you and will protect the people on the bus from you. It's a kind of inverse bodyguard. The prejudice is important to understand and to try to get a feeling for it as palpable. This is not prejudice which is theoretical. This is prejudice like people get beaten, like people get chained. So this is a palpable, serious issue for the family. Can they send you on a bus? Can they afford to send you on a bus? What will happen to you when you get to the other end? How many people have to go with you? And how many people have to stay there, say at this hospital, so as to be able to make sure that you feed? It all costs. It all costs money. And if you want to go to a healer instead, although the healer may well have a value set which means that he or she is not going to put a precise cost on their treatment for you, there is an expectation that you will leave a gift. And so whichever way you look at it, it's going to cost you. And so people have a desperate need to provide, to get into work of one kind or another. We divide work into two parts. We divide it into those people who actually income generate, who actually turn a penny, make some money in coin. And we also have quite a large chunk of people who are doing what we call productive work. Productive work is if a son has become mentally ill, perhaps had schizophrenia, has fallen out of the society in which he's been living, has been vagrant for a while, and then slowly by process comes back through the process that we're describing, and then returns to the farm where he was helping his mother and father in the first place. That's productive work. So he's essentially providing an opportunity for the farm to become more effective and more productive in its own right. Of course, there are myriad other advantages in him being able to join that family again in that farming experience. And some of them are psychotherapeutic effectively, and some of them are to do with the wholeness and wellness of the family. But whichever way you look at it, Livelihoods has an efficacious effect. And it has one of the very few effects, it seems to me, which you can actually demonstrate in terms of destigmatization. Now, if you gave me $1,000 and said, spend it on livelihoods, or $1,000, spend it on a destigmatization program, with posters and some adverts and stuff, I know what I'd do. Every time, a livelihoods program actually helps to make it clear to people that I want to make a contribution to my society, my community. I have value. I have skills. I've been retrained, which in the case of the gentleman in the picture is true. So I would like to make a contribution. And I put to you, isn't that much more destigmatizing in terms of how we understand that than if I, as a government minister, preach to you and tell you that it's don't be unkind to mentally ill people, and you should be nice to them and understand them better and so on. Classic kind of poster kind of advertising. So for me, Livelihoods has many, many values at many levels. And so in order for us to make this as effective as possible, we have started lots of apprenticeships, for example. So these are not formal schemes. The apprenticeships that I'm talking about are the partner knows a guy who is a builder and does carpentry, and the carpenter needs an extra hand. Will you take this person so that they can be taught the skills of your trade? A bicycle repair guy in the marketplace, will you take this person to work with you? And so on. I'm really keen that the skills that we deploy and that we encourage people to learn are the real skills that are needed by that community, even if they're highly competed skills. So I'd much rather that somebody became a tailor, a lady became a tailor, and sat next to a lady who was supervising her and helping her to get back her skill, because she may well have had it before, and that they're sitting in a marketplace with 10 other tailors, because the fact of the matter is that if we teach them skills which are economically eccentric to the area, who's going to have to sustain that program? We are going to have to. We're going to have to keep reinvesting in that program. Whereas if we help people to become masters of their own craft, of the craft that is there in the street and in the community, then they have to compete. So what we've done is we've leveled them up. We've given them the opportunity to play on a relatively level playing field. We've not made them better, in quotation marks, than anybody else, and we've certainly not provided them with more income or a different variety of income than anybody else, but we have assisted them to become equal. Perhaps another important feature of livelihoods, which I wanted to bring to your attention, is the equalizing effect of the informal economy. Now, the informal economy in some cases could mean the black economy. That's another way of describing it. But the informal economy is essentially, and many government authorities will look at the informal economy and say, you mean that's the economy where no one pays any taxes? And yes, that's true. That is true. It is the economy where generally people don't pay taxes. But hang on a minute, isn't that the economy that most of the people that we're talking about are in? Isn't that the majority economy? It's not like it's only a few of us who kind of moonlight and go plumbing or something on the side. It's like what most people do. They're in the informal economy, in low and many middle-income countries. So why is it so important? It's important because it's important for people to be part of the majority economy. That's an equalizing feature right there. But the other thing that's important about it is that in most of the informal economy, let me take you a little example. We start a small restaurant by the side of the road. It's making staple food. We wrap it in a banana leaf. We sell it for a certain price. We make another one, wrap it in a banana leaf, sell it for a certain price. If I feel unwell on a particular day, if I'm having a bad time, if the meds have stopped coming, and meds do stop coming in countries such as what we're talking about, someone else in my family can pick up that restaurant trade and continue to trade. My customers will not get disappointed, and they will not go to another competitor somewhere in the same vicinity. So that's really important. So the informal economy, from our point of view, is actually a great virtue. And the fact that it doesn't yield taxes is less of a worry to us than the fact that it yields opportunity for the citizen. And that's, if you remember what I talked about earlier, the right of the citizen. We were right about the research. It became a really important feature of the organization. And it's gone in many different directions. But the basics of it are that we collect data from the program. That's the basics of it. And the data is valuable and valued. It's valued by academics now, but it's valued by all sorts of people. And it's particularly valued by me, because I know that we're making progress in the right direction, that we're heading in a particular kind of direction, and that we can set our goals as an organization according to the data that we mine. It's still the case that many countries publish poor data in this context. And it's still the case that if it wasn't for some of the people in the room here and others like you, and there would be no real data in many of the countries that we're talking about. And even if it is segmented data, meaning that it's only a portion of the population or a particular slice of time and place, nevertheless, we also make a contribution to those slices of time and place. And the importance of our data, I suspect, is its consistency over time, over quite large populations, but not, of course, necessarily national populations. So we cannot pretend to be providing a replacement for national data, but we can certainly help national data in the sampling that they can do with our material. This nice photograph from our Chinese program is taken in Chongqing County, which is in Hebei province, in about 3 hours or so, a little bit more, outside of Beijing. And we chose to have the program in Beijing because the chief psychiatrist, who said, "You are most welcome, Chris, to come and work here, but you will only work in that one county. Is that all right?" And we said, "Actually, it's perfect. It's perfect. This is a command and control economy, of course, China. So it's perfect," we said, "because you can come and see, you'll know where we are, so you can come and see what progress we make." And she does. And we're now talking, some years later, about the possibility of this whole program being extended to other parts of the country, and it's a very satisfying thing for us to be able to reflect upon. But the people who deliver the program, just like in any other program that we have, are local people, that's clear, but they are particularly the Federation of Disabled People. It's a national federation which goes right the way down, right the way down, right the way down, in our case, to Chongqing County. And it's the local Department of Health, so it's the County Department of Health, which has responsibilities in all areas of health, but they have now taken on mental health. And they have just moved us into a brand new building, which is a fantastic accolade on the part of the authorities, that they feel that this subject has gone from nowhere to quite somewhere. And I think that's a really important feature of this. The Women's Union is there as well. And so these particular structures of both the Communist Party of China and also the government coming together to provide us with the partnership that we need, and to provide us with the support which allows us to demonstrate whether the model works or not. The opportunities are quite tantalizing. Imagine if the Chinese government decided this is a model that they like. We would be able to work with a lot of people. and it would be, a really attractive feature. We already work with a lot of people in India, the other big population country. And so, from our point of view, collaboration has proved itself time and time again to be really important. So we started the story with social entrepreneurship, with having an idea, with trying to meet the gap, and here we are now in the butt end of 2014, and we have been able, in good old British style, thinking of Brendan talking about my MBE, we've been able to colour some of the map in different colours, but hopefully for justifiable and pleasant or reasonable reasons. So we have the program in most of the places, and we have 3 different countries which also host a particular function other than a program. So in India, we looked at the evidence, so we collect our evidence and data, and that's where we do it from. We do it from Bangalore, but we have programs in at least 5 other states in India as well. From Colombo, we have our progress chasing and our computer sciences, that's based out of Colombo in Sri Lanka. We have a sister organization here in the United States, based in Massachusetts, who does a fantastic job in promoting the work of the organization in the United States, but also collects funds. And we have an equivalent organization in Australia in a very small way. So the organization has grown, and we have taken a number of different steps, which now bring us to pretty much up to date. So here's a little look at some of the data, some of the successes and otherwise of the program. So for us, as we went through the operation of the work, we felt that there were 3 categories of people who seemed to be really important and who therefore, as it were, deserved our attention in terms of counting. The first were the people with the mental health problem themselves, obviously, what our Indian colleagues call the affected people. Then there were the carers. Now, the carers in this case don't mean just anybody in the family. They mean, if you are in a village situation or in a ward, in an urban or informal sector, and you have a mentally ill person in your family, quite often the family is told, unless you look after this person, which means walking around behind them as they wander through the township, unless you look after this person, we will chain them. We will incarcerate them. So this is not an idle threat. This happens a lot. So the primary carer is the person who actually really looks after the mentally ill person in that case. It's not if you look at the numbers there on undercurrent, for example, it's not like for like, because not every mentally ill person is in that situation. But it is an amazing number of people who need to have that special care relationship. But the carer, of course, also has their own story, doesn't they? They have hopes, they have ambitions, which in a sense get wiped out once the family has delegated them or designated them to those particular duties. And they often themselves have mental health problems. And so they're a very important group of people that I like to keep a very particular watch on in terms of our impact and in terms of the way we design the delivery of the program overall. Family members in this case is not all members of the person's family, but it is a particular percentile. So it's a 3.3%. So it's 3.3 people per affected person, because we just want to be able to give a kind of sense of the volume which is benefited. But actually, in reality, it's going to be a larger number of family members per affected person, generally speaking. Generally, we're talking about large family numbers. So that's how we divide it out. And then we usually take a baseline. So the green here is the baseline. And we then measure against that baseline as we go forwards. So we were talking about ability to work, And so there you've got this very important contribution of 80% of population, which is a big number. And that includes the ability to generate income, but it also includes the contribution to productive work. It's about 40% on each side. When you measure impact, you have to, of course, go back very much in the same, true to the spirit of community development. If you wanted to consult people in the first place about what was affecting them, and what they thought might be a good solution, and how they might be able to respond to that solution, then you have to go back to them consistently from time to time. And so the qualitative data that you produce or adduce is also very important, it seems to me. It's extremely important to know in mass and individually how people respond to these particular programs. So the way forward for us is not surprisingly more than one strand. We are focusing down on the 12 countries that we work in at the current time, and we are going to use at least 11 of those countries as being major hubs of activity. The relationships that we enjoy already with the governments will be increased, and we will attempt to increase the surface area, if I can put it that way. In other words, the number of people who are involved in our program in that country. Because a traditional Western approach to programming basically means you go in on 3-year cycles. So what we want to be able to do is to take those 11 countries and roll them into independent organizations. And we've done that now with India. We have done it with Ghana, with Uganda, Tanzania, Kenya in 2015, Vietnam in 2015. And what I mean is that those organizations will then, those entities will then be separate structures within a family of basic needs organizations. Because it seems to me that it's important that we find new or creative ways to not only engender innovation, but also engender creativity in terms of financing and funding and so on. And so what I want to be able to do is ensure that the organization as a whole, as you have been looking at it today, is not entirely reliant upon a very small fundraising team in the UK. That seems to me to be a really dangerous way of growing an organization. But it does seem to be possible to be able to grow your leadership in Ghana, in Uganda, etc., to grow your leadership and to encourage that leadership to dare, I use the words advisedly, to dare to create their own organization. So I'm using the basics, the entrails of social entrepreneurship to try to see who amongst the people who are in the program so far, who amongst them dares to go to the next level and start, with my support, their own organization. Some of these organizations are going to be licensed in terms of the one in India, for example. It's called Basic Needs India, Basic Needs Ghana, whatever. But in some cases, the Vietnamese organization will probably be called another name. And they will then carry, within their website and on their nomenclature, they'll carry a small recognition of the fact that they're part of the Basic Needs family. This depends upon local registration customs. It depends upon the leadership of the individuals. It depends upon a number of things. But by the time we get to the end of 2015, 2016, we will have an effective circular coronet of organizations, which I think will be important. That won't stop us starting new ones. For example, we're just starting now in Pakistan, in Karachi. We've got the first 1,000 mentioned of people in the program in Karachi. Karachi promises to be a big program, and so we are going to be able to continue developing new programs as we roll out the older ones into independent structures. So Ladies and gentlemen, thank you very much for giving me your attention. I hope you found it of interest.